What's up, everyone? This is Jamie Glick with the Mental Health Training Camp. Today, I'm talking to anyone who's thinking about being a therapist. You know, you want to help people, you know, you want to be in the mental health field, but you're not really sure how to do that. So, people ask me all the time, what degree should I get? I will tell you right now, there's really three main options. You can get a clinical social work degree, you can get a clinical counseling degree, or you can get a psychology degree. Those are all very different and have different challenges, different strengths. And I interviewed two therapists to talk about that very thing. So listen in. This is a topic that I get a lot from people who are looking to enter the field of mental health. But they know they want to provide mental health services, but they don't know what avenue that they should go. And there's different avenues you can go, right? And so I want to discuss that as just a beginning video for the Mental Health Training Camp YouTube channel for those who subscribe, who listen in, and are interested in doing mental health work. So if you all could just start off just with a brief introduction.
Joy, do you want to go first?
Okay, I'll go. Hi, my name is Joy Acaso. I am a licensed clinical social worker licensed in Florida, but my official title currently is an anxiety support coach and licensed psychotherapist. So I specialize in providing stress and anxiety solutions for busy women to help them deepen their capacity for joy, love, connection, and achievement. And I do that by providing them with resources through neuroscience, brain health, and somatic work.
Awesome. I need to talk to you too. No.
Oh, sure.
That's amazing. Hi, everybody. My name is Kara Crosswhite-Brindle. I'm a licensed professional counselor, approved clinical supervisor, and certified financial therapist, level 1. Lots of alphabet soup behind all of our names because we all do awesome things. But I've evolved from working with youth and at-risk youth on probation to now working mostly with folks suffering from perfectionism, workaholism, and burnout, which can include my fellow colleagues as well as med students, which are some of my favorite people to work with. So that's what I do.
Very good. And I'm Jamie Glick. I'll be facilitating this conversation. I'm a licensed clinical social worker. So we've got two social workers and one professional counselor. So it's two against one.
Uh-oh, should I be worried?
But I licensed clinical social worker, licensed addictions counselor. I do a lot of different things, provide direct services. I oversee programs. I teach at the university. I have a podcast, YouTube channel as well. So I've been able to do a lot of different things with the degree, which is great. And so just kind of the first question for both of you, why did you choose the route that you chose?
Kara, you want to go first?
You want me to? I'm like, who should go first? Why did I choose this route? Well, naming that I didn't have a lot of awareness of all the different parts of the field, I think it was probably the most easy to recognize going with a bachelor's in psychology to then going into a master's in counseling psychology, which for viewers basically means being trained to be a therapist. And for me, what enticed me was the one-on-one work. So picking a program that was clinical and focused and saying this is the direction to go for private practice eventually was probably the very limited insight I had with my bachelor's degree. Like, sounds good, because no one said here are all the designations. So I appreciate this video helping people say there are lots of things to choose from.
Yes.
Yeah. What about you, Joy?
I agree. I was also the same way. I didn't even know because I was born in the Philippines. So when I came here, I did not know what I wanted to do in college and things like that. So I got my bachelor's in public management, not knowing what I wanted to do with it. I was going to go into nonprofit because speaking of youth, Kara, I worked with my youth group in the past. And so I really love that. But before graduating with my bachelor's, I wrote a paper, or I researched and wrote a paper on children and social welfare. And that got me so fascinated with social work. And so I said, oh, there's such thing as social work. And it sounded back then like I could do everything I ever wanted with social work. I could teach, I could facilitate groups, I could educate people. So I said, okay, let me try this. And I haven't looked back since.
Yeah, that's great. And for me, similar to Kara, bachelor's in psychology and wasn't really sure what I wanted to do next. And I got some advice that if you want to do mental health work, or if you want to help people and you're not really sure exactly what you want to do, social work is a good route to go. And we'll talk about strengths and weaknesses of the different degrees. And I think that's certainly a strength of the social work degree. It is very broad. There's weaknesses to that as well, but it is very broad. So it opens up a lot of doors for you. And sometimes you think you know what you want to do, but then it changes as well, right? And so it does give you a lot of different opportunities. So we spoke about it a little bit already, but what are some of the things that you've been able to do with your specific degree?
Joy, you want to start that one?
Sure. So with my specific degree, as a master's degree holder, right, and MSW, I was able to work in community-based programs and after school programs through an outreach by a hospital organization. So that was great. At-risk youth is what we did. We did a diversion program for the youth. We facilitated groups and individual counseling at that point. And then about 3 years later, a door opened for me to become a social worker in dialysis. So I also have background in medical social work, which I loved. I stayed in it for 7 years. I worked with a multidisciplinary team of dietitians, doctors, nurses, and technicians. I loved it. I had 22 patients every day. So about 100 that I had to write notes on. I don't know if we're if we're gonna discuss the writing notes part, but so that, and then while my kids were growing up, I said, maybe I'll go ahead and try private practice. It started as a part-time at first, and then went into full-time. I never really thought about going into private practice. I thought that I would always work for someone else, quote unquote, right?
Yeah.
Didn't even want to get my license, but we were required as a dialysis social worker to get our license.
Yeah, that's great. That's some diverse opportunities there.
Yes.
Wow.
Yeah. What about you, Kara?
Similar to Joy, I started in community mental health. That's kind of the expectation of professional counselors, is you have to start in that setting, which means being overworked and large caseloads, but a lot of diversity, which I think actually primes therapists to be more prepared for private practice. So I'm actually a huge fan, and I champion people to start there. I think you learn so much in what feels like 6 years, which actually was 3. It's just, you feel a lot of stuff, and there's a lot of crises that you get to navigate and learn those skills. So I started there, had a wonderful supervisor who saw my leadership potential and promoted me into a supervision role a couple of years into that. And I had a team of 15 green therapists that I was responsible for, which was lovely, but really bad for boundaries. And so as I started to navigate, what I didn't know then was burnout. I was pushing to go into private practice because I'd kind of hit a income ceiling of like, this is all money I can make. I'm licensed, I'm a supervisor. There's nowhere else to go within that agency. And so this wonderful supervisor, who really was pretty logical about this as a stepping stone for many people, encouraged me to go into private practice for myself. And within 6 months of taking Medicaid, I was full. And I had supervisees come back and say, can I work under you? So I all of a sudden had a group practice that I never planned for. And then because I'm a serial entrepreneur, I was like, oh, every 2 years I got to start something new. So started teaching after that. I wrote a couple books, and then started publicly speaking on suicide assessment for our colleagues who were afraid of suicide and didn't know how to do this with clients. If they were like me, I had an hour of training, and that was not sufficient for the clients that I was serving. So I had a lot of passion for that. Did a TEDx talk, and now in the pandemic, my latest project was the certified financial therapy component, because I'd moved into consultation and supervision, and was like, how do I still continue to help our colleagues who were benefiting from classes and coursework that I was doing, but now also wanted a financial component. So that's where I am now.
Yeah, also, it's interesting, also very diverse, right, in your experiences.
Yes.
And I started also in community mental health, and we can have a whole nother conversation about
I was gonna say all of that.
Yeah, that's a whole other thing. But yeah, I started there, and I'm grateful. I'm grateful that I started there, and I certainly grew a lot. And then I moved into residential and spent a lot of my career in residential. That's another experience where you just grow quite a bit. And so I'm still involved in some residential programs, some outpatient programs still as well. I've started my own practice. I get bored easy. So I like Kara, I'm always starting something new or have a new idea. So I started a podcast, started a YouTube channel. That's why we're here today. And also teach at the university. And so what I enjoy about being a social worker and in my career is that's very diverse. Every day is a little different. I have a lot of symptoms of ADHD. And so for me, I need differences in my days. I need diversity and I need some level of excitement, right? I need something to engage me. I need something. I'm kind of a thrill junkie, right? And so I need that to stay stimulated, to stay engaged in what I'm doing. And so, fortunately, I've been able to be in situations where I get that. And, I am not the person who can sit. It's interesting because I'm a therapist and I'm actually a really good therapist and I can stay engaged in a therapy meeting, a therapy session. But if you put me into like a boardroom for a management meeting, I struggle. Like it's hard for me to stay focused and stay engaged for that period of time. But so it sounds like we've all had different diverse opportunities and experiences, which is great. And so thinking about your degree and the decision that you made to get your degree, what do you think are some of the strengths and weaknesses that you've found maybe with that, going that route or with that degree?
I think for me, I think we've all named it as a strength, but I think there are plenty of people in the community who would see it as a weakness, is that there is an expectation that you start in an agency or in a big community mental health center, and that comes with challenges. And maybe it's poor supervision or being overworked, but it also leads to a lot of skill development and crisis and critical incident exposure. So
Yeah.
I see it as a win, but I think there's probably some things that need to be addressed with that to make that a better fit. Different project down the road. But yeah, I think, the biggest challenge with counselors is the stereotypes of who we are and what we do. And, so you get paid to ask people about feelings and, like just things that could be comical, could be offensive. All of it is something we're subjected to. I know that we're also confused with all the different designations, right? So I'm sure you've all been called counselors and I've been called a social worker. And so I really appreciate that we're talking about this, so people could see the differences and yet know that we all have the same, goal in mind, which is helping people.
Yeah. And I have some assumptions, Kara, about your degree. I don't know your degree. I'm not an expert in your degree, but my assumptions have always been that with a professional counseling degree, you get a lot of skills training. And it's very specific and designed to be very specific, which has a strength because if you want to be a therapist, for example, that's what you're training to do.
Right.
If you get into the field and maybe realize that therapy is not for you, but you want to do something else, and maybe you may have some challenges. I know in hospital social work, for example, they look for, or in hospitals, they look for social workers. In schools, a lot of times they're looking specifically for social workers. So are my perceptions accurate? What are your thoughts about that?
Yeah, I mean, I think that there is some truth to that because counselors, we go that clinical track, right? So we're not necessarily going to go to school track or any of the wraparound services that social work can entail. It's caused barriers for the schools where they're like, hey, we don't have enough mental health professionals to serve students. And this is something I've talked to legislation about here in Colorado because for those of us who came from agency work, we were actually thrown into situations that would allow us to develop the wraparound care, the case management, the access to resources. And so they really were doing a disservice not looking at all of the designations for that role. But yeah, I think most people think you go professional counselor if you're going to work in an office, face-to-face, individual or family therapy or couples. And that's kind of how it is modalities is the focus of cognitive behavioral therapy, motivational interviewing, whatever that is. But less about, I think up until recently, less about the multicultural components, which would be a weakness until recently where they're like, oh, this is really something we need to improve upon.
Yeah, and I've been involved in a lot of social work programs, both taking on interns, but also teaching in different programs. I've taught in a couple different programs. And one of my critiques of social work programs is they do a really good job looking at diversity, equity, inclusion, a lot of theoretical frameworks. It's very broad. Your knowledge base is very broad. But if you want to go into mental health work, for example, there's only a few courses that you can typically take. And even though that coursework is oftentimes very theoretical. And so I know as coming out of a social work program, I had to do a lot more research to be an effective therapist. And I know as I hire new staff who are fresh out of school or even bring on interns, I almost have to assume, at least from a therapy perspective, I almost have to assume that they don't know anything and start from scratch.
Yeah,
And
good.
it's frustrating to me as a clinical supervisor. It's frustrating as a professor too, and I'm working with the university to enhance that. But it's frustrating to me as a clinical supervisor to get someone from a school with a master's degree, and I feel like I'm having to start from scratch. It shouldn't be like that. And I think now more than ever, in the spirit of providing access to more people for services, we're allowing people to provide services sooner. And so now we can bill for clinical interns and different things like that. And that, to me, that's really scary, because I know for a fact that we have a lot of people in the field providing mental health work and mental health services that really don't know what they're doing. And that's where, Kara, I'm sure you'll say, well, that's where clinical supervision comes in place, which is true. But
if
not
they have a
over-
good one.
But
if they have a good
yeah,
one, right? And or if you sometimes you even have good ones, but they're so busy doing
Right.
what they're having to do, and so they're not really present for that supervision meeting, or they're rescheduling meetings all the time because they're overwhelmed, right? And when I think about our state of mental health right now, that's one of the scariest things to me, is that we just have people providing mental health services to people who really need it, and some of those folks are in life or death type situations, and people are not equipped to do the work. And so that's something that's really important to me, and I'm really passionate about. This part of the reason why I started this channel as well, because I want to start building those skills for people and at least give them an access. And it's never going to take the place of clinical supervision, nor it shouldn't, but just have a place where people can learn some of those skills if maybe they didn't get those in their academic programs. Joy, what are your thoughts?
yes, I completely agree with everything that you all said. It's funny because, my mom used to say, why don't you go to med school and become a doctor? And I said, I'm not gonna spend 20 years of my life in school. But now looking back with what you were saying, Jamie, about specializing and having to train because I wanted to be in the therapy space, and as a social worker, I don't think I had that background. So I've had to really seek specialized training. So looking back, I'm like, oh, I should have gone to med school all the years that I spent studying more outside of, after graduation. And one thing that just wanted to add to that is the neuroscience piece, because for me, my social work program was huge on person and environment theory, right? But you both have psychology degrees. So, I had a minor, but even then, I don't think we talked about the brain a lot and how, or the mind, and how it really affects a lot of the things that we do, the things that, happen to us. And so that's been the piece that, I went to training for. However, the people that train neuroscience are not mental health therapists. So I've had to also take that information, try to translate it, and see how I can apply it in my sessions. And that was a little bit, frustrating and sad for me, because I said, why aren't social workers trained in this? But then what you said, not a lot of us really go into the therapy route, I guess. And so, but what I've done,
but they do, because I've done some research on this, and social workers are the highest percentage of mental health providers in the country.
Okay.
And so we're out there.
Yes,
we're out there, and that's why there should be a lot of pressure on universities to start preparing students, social work students, to prepare them better to be mental health professionals and be therapists. And part of that is social workers identifying earlier on what they want to do, and that always changes, right? And it can certainly change. But I think about other professions, like usually a dentist, for example. If you go to school to be a dentist, you don't come out of your school and go into dentistry kind of knowing what you're doing, right? Would you go to a dentist that kind of knows what they're doing? No.
Yeah.
You want them to know, at least have a really good foundation of skills. You're always going to, you're always going to learn more throughout your career, but you need to have a really solid foundation of skills that now you just build off of, right?
Yes,
you don't come out, but what we have instead, a lot of times, at least in social work, I feel like is, students with few skills, good foundational theory, good foundational knowledge, And then when they go into their first job, that's when they're really working hard and almost playing catch up to gain some of those skills. And I will say that internships are really helpful in both programs. I think that's where a lot of the learning takes place, but we can't rely on internships either.
Of course, yeah. What I've done with my frustration for not knowing about the brain or the neuroscience piece is create a course for social workers. But not just because it's different to know the knowledge, but then how do you then explain that to your clients so that it's beneficial for them? And so I tested it and I said, let me see if social workers want this. And they did. And I had students who were, who have been practicing 10, 15 years, and we shared the same frustration. So that was great. I felt validated, but also, so I want to develop that some more too.
Yeah, and that's great that you offer that, because we should be lifelong learners in this field, yes. And having opportunities like that is really helpful. And I know, Carrie, you've got you've got different trainings and things that you offer too, supervision. And what I like about what you do too is you spend some time teaching clinical supervisors how to be clinical supervisors and effective clinical supervisors, and that's key too, right? I mean, it's since given all the things that we discussed, that makes your internships more important. It makes your clinical supervision when you get into the field more important. It makes your own personal research more important so that you can be effective at what you do.
Right. Exactly.
So last question, for those who are listening, who may be considering going into the mental health field, what advice would you give them about what route they may want to go, or just, what to consider when they're considering what type of degree to get?
Joy, do you want to go first on this one?
I'm thinking about this.
Well, I can go. I have my answer.
Okay, go ahead. Yes.
I was like, how can I make this distinct? Because there's so many ideas, right? I think that's what your face is telling me, is like, there's so many things. What I would recommend to anyone watching or listening to this video is to interview people in these different professions. Ask them what a typical day in their profession looks like. I know some of the students have had this task in the past when it comes to universities, saying go interview a social worker, go interview a therapist, go interview a psychologist. And it really sheds light on the things we're talking about, of like, oh, you had an assumption of what they would be doing. But when they tell you my typical day looks like this, does that change their interest level in it? Does that make them more excited to be in that position? Or does that make them go, oh my gosh, that's nothing that I want? So I think having these like candid conversations with professionals who are willing to talk about that, to talk about the strengths, to talk about the challenges, could be really eye-opening versus looking at a pamphlet and saying, this sounds good on paper, or here's a program that's saying they're amazing. Like, if you don't have a clear picture of the big picture down the road, can these interviews help shed some light?
Yeah, that's great advice. What do you think, Joy?
Yeah, I love that. And it's great, Jamie, that you have this. This is probably what I needed when I was in school, right? And I get those questions a lot too, of like, should I do this or that? But if you have like a certain inclination, an idea, of what you want to do and what route you want to explore, I think what Kara said is really good. Interview people, ask them. And most mental health professionals really will take the time, right, to sit down with you and, answer those questions for you. And I think that kind of openness in our field is truly helpful for the up and coming ones who want to learn more.
Yeah, that's good. And I'll tell people, because I think a lot of times people don't enter this field because they don't feel like they're going to make an income that meets their needs. And, I always tell people a couple of things. Number one, this field, just like any other field, weeds people out. And, people who are good at what they do, they advance in their careers. And people who maybe don't invest as much or are not as effective, they don't advance at the same speed, right? I will also say that there is money to be made in this field, and at least in social work, there's a saying that's overplayed, and it's we're not in this for the money, and of course we're not. But at the same time, that shouldn't diminish our value. We should get paid what we're worth, right? And that's a message that I tell people all the time, because we do diminish our value. Even us saying over and over again, we're not in this for the money, diminishes our value, and it gives people an excuse to pay us less, right? And so we need to understand our value. And I think our society is starting to see. I think we're still a long ways from society understanding our value, but we need to understand our value and just find creative ways and really find your niche. I think that's what oftentimes separates people as far as the type of income you're able to make is when you really find that niche and that you become desirable. Like people want your services, they feel like they need your services, and then they're also willing to pay you more for those services. And so, yeah, we're not in it for the money. I completely get that, but let's also get paid our value.
Are you sure you're not a financial
agree.
therapist, Jamie? Look
Look
at you championing
Yeah.
everybody.
Yes,
I'm
it's so
not a
important.
financial. Yeah.
So important.
No, I have needs. I'm not a financial therapist. I just have financial needs. I know you don't know
Right.
much
You're
about
like,
me,
this is
but
the reality.
I have three kids,
Yes.
and they're all very
Oh,
expensive.
there you go.
It's about I was talking to my partner about this yesterday. It's all about your income versus your expenses, right?
Mm,
And it's okay to spend more if you make more. It doesn't mean you have to, but but it's also if you don't make more, then spend less, right? So
yeah. It's one
any,
strategy.
that's one strategy. I'd love to hear more. We're definitely going to spend some time hearing more about that. Any other
Yeah.
thoughts on this topic for both of you?
I hope this video will also, as much as it will educate folks, I hope it will also help them see that we all came together in collaboration. I think one of my most heartbreaking observations is the us versus them that
Mhm.
happens between professional counselors and professional social workers.
Yeah.
And so I think, knowing that we all are coming at this from a good place and we all do have the same mutual goal of helping people, I would really like to see that dialogue stop where it's like, I'm better than you, you're better than me. Like it doesn't serve, and it's obviously not helping the people who are in crisis for us to be fighting and bickering about who's better. So I hope that's okay to say in this video, but I was just
Yeah.
thinking about what you both
Yes.
said, and I really appreciate being enlightened on what you guys are doing in your careers and being like, that's amazing. How do I support that? Versus being like, oh my gosh, your competition,
Mhm.
which I think is, at least here in Colorado, something that I'm noticing.
Really, yeah, and the need is huge,
Yeah.
right? The need is huge, and when you have that client in front of you that's in crisis, they don't care if you're a social worker, they don't care if you're a professional
Right.
counselor.
That's true.
They want to
That's
know
true.
how are you going to help
You
me,
can help
right?
them.
Exactly.
Yes.
That's all they care about, and we all have different skills and different backgrounds to be able to do that. So I love diversity in the field, whether it be degrees, whether it be race, whether it be sexual orientation, whatever it is, because I can't help everyone, right?
Right.
Here,
Yeah.
you can't help everyone. Joy, you can't help everyone, but
Yeah.
there's all people that we can't help.
Yeah. Absolutely. I think there's so many things that were said here today that we could just like break down and maybe do more and talk about all the things. But I appreciate, definitely this time learning about what you do also, Kara, and your passions, Jamie. So it's really good.
Yeah, good. Well, I appreciate all of your time.